Hi, it's Matt Kendall here again. It's the 4th of November. I'm here with Sally today. Sally did her IEMT training last month. We've just done her basically like a consultation feedback on the case studies that she's provided. So today she's becoming an IEMT practitioner. That's me being excited, by the way.
I was going to go, wait.
It is a sort of a good thing because, you obviously when you do the training, you're then asked to go and do these case studies, and then we go over everything. And it's a chance to sort of give you just some extra help, really. It's not really sort of marketing as such, just to make sure you've understood everything, and then you can do it. And now obviously you can join the association. There's a webinar tomorrow, by the way, if you haven't seen, about false memories, and you obviously get all the benefits of being in the association. And I'll be able to give you your certificate later today, which is great. So Sally, right, who are you? What did you do? So before IEMT, what's your experience in therapy? What's your career? Basically, just tell us a little bit about yourself.
Okay, well, I've been doing hypnotherapy now for, I don't know, sort of a couple of years. I learned hypnosis first, but I've also learned NLP. I'm an NLP practitioner, and I've learned other techniques before IEMT as well, which is, they're good to have treating clients, because not every technique suits every person.
Yeah.
So I've been doing that for a couple of years, and I love doing sessions. It's like, and seeing the change in people is what really gets you. It's like, yay, I love it.
So you're doing NLP and hypnotherapy. Were you working with any type of people in particular at all, or?
I didn't start off that way, but latterly I've been doing a lot of work around helping people with their confidence. So I ran some group online sessions.
Oh, cool.
In general confidence, but also specific to interviews, networking, and working on Zoom, because a lot of people get nervous about being online. And so I've had a bit of success around that, and I've had good reviews on that to say that.
Excellent.
So I'm planning on working on that a bit more and concentrating on a couple of different aspects of confidence to, for different things. So that's what I'm planning to do.
Cool. So background in NLP and hypnotherapy, working with people, sort of confidence-related issues. So how was it that you heard about IEMT? Did you know about it? Did you know about EMDR? So basically, how did you get introduced to me, and what was the process around that?
Well, being in, the therapy circuit, you get to know quite, you see all these the techniques being talked about, and I'd heard of EMDR and IEMT. Hadn't really had much to do with them. But then I watched you do a demo in a group I'm in of the IEMT. And it worked. So I thought, oh, yeah, that's good. And then I watched one of your I think it was either a live or a webinar where you were talking about the upcoming training. And so I went for it. So I decided to go for it. And it's, another string to my bow, if you like. But it's like a standalone technique that it's different to hypnosis, because you can, it's just general, if you like, but IEMT is a standalone technique, so I was quite interested in doing it.
Yeah, because basically IEMT is obviously I teach it as pure IEMT, and it is a standalone technique in how you use it. But then what we encourage people to do is integrate the IEMT, because EMDR, for example, is a 7-phase, I believe it's like a 7-phase system on a particular negative memory or belief, and you go through 7 different phases.
Yeah.
And that can take a long time as well. That could take several sessions to go through. IEMT is much more, here's a set of tools. These are some which move the eyes, and these are some other things. And so it's like a suite of tools that we use.
Yeah.
And I train people to do certain things in certain sessions, but the better you get, the more you can just work with what's coming out, so you don't have to, if you get some sort of belief, you don't go, well, we'll wait till next week. You work with what's there, you work with what's there. But I don't like to overwhelm people at the beginning. So I say separate it all out. And so IEMT can be very easily integrated into CBT, talking therapy, counseling, coaching, hypnosis, because you're using, there's a memory, there's a feeling, there's an identity, there's a situation, there's PTSD. So you can work with what's actually coming out. So I always say it's great to work on its own. It's brilliant when you integrate it with something else.
Yeah, there were a couple of points on the case studies where I thought, oh, I could do that with somebody, but because it's a case study on IEMT, I didn't do that. And if, when I use it in the future, if something like that happens, then I will integrate other things.
And that's exactly the thing. Okay, yeah. So you went to the weekend. It was again, I think it was about sort of 3 weekends ago or something now.
Yeah.
So it's a 9:30 to 5 on both days. And there's a lot of stuff that we go through. So I'm going to throw a lot of questions at you at once, and then we're going to sort of break it up. So basically just your honest experience of the pre-content. So basically what you got sort of beforehand, the actual training itself, what you thought about the content, the materials, the way it was presented, the breakout rooms, the benefits that you had and that you witnessed as well. So basically just thinking about those points, what was the weekend experience like for yourself?
It was really good. You sent out the manual beforehand, and instructions for joining and everything like that. So that was all straightforward. And so I had a quick read through the manual, as you advised us to do, and then read it again. Obviously, until you do the training, a lot of it, you don't really understand or know. But yeah, that was really good. The training itself, I thought it was a great bunch of people. It was met some lovely people on there from different places, and working through the manual was good because you split it into modules, so you're not dealing with a big, like, everything together. You're working through the modules. So and working in the breakout rooms was really good, doing the practices, and I had some good results, either way. So, and I think what struck us all was the very first day, the end exercise that we did. I think when we did the second day, the feedback was that was the favorite bit of the day. Not that everything else was bad. It was just good. So I will be using that definitely,
the episodic time. What happened?
Yeah, because that's quite useful for people. And then the second day we moved on to the identity work, and that was good. And you did a demo with me. And you were asking me the questions about the identity, and I was thinking, oh, I got a lot here. But I think what it showed the other people on the training was the effect of the eye movements. I think somebody commented that before we did the eye movements, my eyes were all over the place, and they could see a real difference afterwards. So that for me was a big thing, and since then I think that has helped me in situations since then. So yeah, that was good. But I said I enjoyed meeting all the people on there, but you managed it in a very I don't know, not matter of fact, but this is what we're going to do. And that's what we're going to do. So it was really good. I'm not sure what else to say. Was there another question? No, I forgot the other question.
Well, that's it really. Basically, so because when we
the aftercare was really good, because then obviously you sent us a lot of templates for the case studies, etc., which it is a really structured way for somebody that hasn't done a case study before, like me, as such, and to work through with the people that I did the case studies with. So I think if I hadn't have had that template, I don't know, maybe it would have been a little bit more difficult.
More confused, exactly. And what I try to really do is take these quite bizarre concepts really and make them into modules. So it's literally a step-by-step approach. And so you break everything down. I always like to think that the way I teach IEMT is it's like giving people Lego blocks, and you can then build stuff up. You take one bit out, you're focusing on this one bit, And then if you need to do something else, you can, but then you come back to this bit and then you build it, and you literally build a session by these blocks rather than it being more, when I say free flowing, it's like learning a sequence. It's like the way I kind of teach it is like learning scales, doing drills, do the drills. And then basically when you're actually working with clients, you can work on intuition and instinct. But basically, I'm trying to teach you the drills. And the way that I teach everything, so yeah, there's about 12, 13 modules or something. And most of the modules, some of the modules is just an explanation, an introduction to the next module, really. So with each module, there'll be, I will introduce it and talk about it and present what it is. There will then be a demonstration, which I do with somebody who's in the class. You then go into the private breakout rooms and work on each other. And you get to work as the practitioner and as the client. And then we come back into the room and we basically discuss our findings, experiences, and ask any further questions. And I like to get everyone up to that point before we then move on to the next module to make sure that we don't leave anyone behind, they don't feel overwhelmed, to make sure they understand the concept. And when you were in these breakout rooms, did you see, I know that we did some not in person, but in the rooms as well. What kind of changes and experiences did you witness as you were being the practitioner? What was that like?
Yeah, it was, we had some really good changes, to be honest. Sometimes it's weird to see people change sort of in front of your face, you know. Like when you did the demo with me, people could see that happening, and that is powerful. So yeah, everybody that I worked in the breakout rooms was really good. They got a good result. And you know, when I was a client, I got good results as well. So yeah,
have you watched because I do record the entire weekend as well for people to watch afterwards. Have you watched the demonstration that we did together?
I haven't actually. I did start to watch them, but then I got into the case studies and I thought, oh, back up with that. So yeah,
I think you'll find it very interesting because your demeanor's different. Yeah, it's much more solid than. It's kind of hard to explain, but I think that when you watch it back, it'll be sort of a bit strange for you to watch because the person that we did it with was a much more fragile person, is the best way I can describe it.
Yeah, and I did speak to somebody the other day, a bit of a mentor for me, and he noticed the difference straight away in me. So yeah, and that's the thing, when other people notice the difference, it as well, not only that you feel it, and I do feel that. I do feel that.
I would say there's much more certainty in your voice.
Yes.
I think that yes, there is. No, I definitely pick up on that. There's much more certainty in your voice, which is really good. And with IEMT, we're not trying to make you feel good. I wasn't there going, you're a strong, confident person. IEMT is about understanding the imprints of how you learn how to be and feel a certain way, so we can readdress them by using the eye movements, and then you can make better decisions, have clarity of thought, and better emotional control, basically, in the present day. So
yeah, I mean, I still remember what the situations were, but how I feel about that, or how it appears to me now, is, I mean, I know it happened, but now part of it, I think, for me, was that I understand what was going on at the time. And the fact that obviously you're seeing it through a different perspective.
This is it. And IEMT allows you to get a different perspective of what's happened. When you change the way you look at something, the thing you look at changes. So we're not trying to, it's like, I did some metaphor work with somebody once. And I think that when you read a lot of sales stuff as well, especially like Tony Robbins stuff, it's like smash those walls down. It's like, whoa. You don't need to be smashing stuff. You know, it's like you don't need to sort of, well, just imagine it to be different. Well, it's not though. So this is why IEMT works really well with metaphors of movement and hypnotic languaging, because you can go literally from one to the other. And I don't know what I'm doing there, but you know, you sort of combine, and that's what I do. I will always listen to a metaphor, then do IEMT work and come back to the metaphor later.
Yeah.
It's easier to change the person within the metaphor once you've done the emotional and the identity releasing kind of stuff.
Yeah.
Releasing.
Yeah.
Is that the right word? Yeah. Processing. Processing, should we say. And you've also, I set up a WhatsApp group, which is a very active WhatsApp group, to be honest. My phone's, I've had to put it on silent.
I've put my notifications on silent,
Yeah.
to be honest.
And so there's lots of people chatting in there. There's lots of people sorting out, you're just sharing their wins and which has been really good, So I set a group up. I usually have left by now, to be honest, but so I set a group up for when people go through the course. So there's 10 of you on your course, because a couple of people make it. Yeah. You're all just chatting, sorting out, organizing your own practice sessions, which I encourage people to do, and just sharing. There's been some amazing feedback from people working with clients and just sharing their feedback of working with people. And then obviously it's the Facebook group as well, which I run, which we do stuff there as well. I don't think I've had any. I don't think you've asked me any questions via email or anything. I'm not sure if you've.
No. I've asked you. I think I've asked you a couple of things on your lives that you've done.
Oh right, okay,
but not on email, I don't think. But
so I do a lot of stuff. So you feel fully supported post course?
Yeah. There's somebody there to answer a question, and the people that I trained with, like in the group, they're really encouraging and really. Somebody qualified, was it yesterday? And it's just like, yay! Are you going to be next? Isabel, that's what I was going to say. Was it yesterday? Yesterday or the day before, but she. So
this week.
This week. I lose track.
And she was based out in Thailand as well.
Thailand, yeah.
So it just shows you the training now. We use it online, and the way that I train people how to use it online. Yes, you can use it in person, but I think that the therapy world really is, and the future is very heavily based on.
Yeah, I was very impressed with her being there at midnight at the end of the day, because it was I think it was midnight for her when the course finished. So yeah,
I've had attendees attend from Canada, because Joyce was in Texas, Las Vegas, and so we had people from America, Thailand. Yeah, it's a brilliant. And then obviously now where technology is, it's you're together, centralized. You've got WhatsApp and you've got Zoom, and it's all great. Yeah. So we do the training. Yeah. You learn all the skills, the tools, the techniques, and also not the mindset, but the underpinning things, these patterns of chronicity, this way of working. And the way of working, some people can find, especially those who have come from a support and care background, of allowing the client to talk about their problems, about their story. In IEMT, we don't really take much content at all, because we don't need to, and it detracts from the work we're actually going to do. Yeah. So how did you feel? I know you've done some NLP and stuff like that, can be like that as well. So how did you find working with your clients? So taking the skills from the weekend and then applying them in working with your case studies, and obviously without giving any confidential information, how's it been applying and the results you've actually achieved since the course?
Yeah, to be honest, I think this is the best thing about your training, is the case studies afterwards, because it is a way to, for me to use it in a controlled situation. So I, like I said, with the templates that you give, so you know exactly what you're doing, and the flow of what you're doing, more than one thing, from one thing to another, and how it links in, in some way. So we have a full structure that we work towards, and that really helps, because you're not thinking about, oh, what do I do next, if you like. I found the case studies very interesting. Personally, I find it difficult to talk as much. I find it difficult to stop the talking, but I did, and that's something that it makes a difference when you don't talk about things. Because you're purely working with what the client is seeing and feeling and experiencing. Yeah. Not what I would say about what they were thinking about, the situations and stuff.
Or the justification of it.
Yeah. So you are purely dealing with their experience of it and how they felt about it or how they feel about it. And I had some good results in my case studies. I was really pleased how they turned out. And I think the fact that you've done the 2 case studies and, you know, we've gone through them and you've given me, excuse me, a couple of tips on top of what I did, which is that would be really useful for me going forward. Because there was extra things that I could do and questions that I could ask, and that's really good feedback. And like you said, it's not a criticism. It's
it's basically, you know, because as I said, everything you did was really good. Here are some extra things that you can now include to take it a little bit further. And just some stuff that you can sort of try out and add in, you know.
And both clients were totally different in terms of what they were dealing with. And I've had some feedback from a lady this morning about how she thought it went and how she's feeling now, so that's good. And
so let me ask you, with generally with the case study person, that this lady you actually worked with, the feedback that she gave you, what was the type of feedback in the way that she's actually changed?
The way that she's actually changed is it's difficult to say without giving away details. But she was getting some physical symptoms of a problem, and those physical symptoms have now gone in a situation where before I did the IEMT, she would have had those physical symptoms. And so for her, that is a big difference. It gives her then the confidence, more confidence to do things that she may not have done before. And so it's sort of, I wouldn't say it's changed her life, I suppose, maybe because I think that's a bit big-headed, but it has changed a lot of things for her, and she feels more relaxed, more confident, as I said, in the things that she's doing. And to me, that's a good result. So
I like it when something's tangible. Rather than just like, how are you? I'm feeling well. Okay, but what have you done? I always like, and this is why I think IEMT is great when you combine it with something, especially something like coaching, teaching, or training, because you're actually going through and, you know, helping somebody to actually achieve something tangible. I always say, if you've got the emotional stuff here, which you're working with IEMT or hypnotherapy, whatever it might be, your skill set, and then the technical thing, that's the skills required. When you combine those two, you get an overall great result. You will get a result doing this, you'll get a result doing that. Okay, combining the two is you know, greater than the sum of its parts. You know, the whole is greater than the sum of its parts. You get a really, really great result. In fact, what we were just saying before about doing, you know, to taking this forward, specializing and working with people in a very specific niche, whilst giving a form of training and using IEMT when the problems arise, that's where you get really good results. And from a marketing perspective, that's how you position yourself as an authority. And you know, you gain your case studies and you gain your testimonials. So let me ask you, you said that it gave you a real boost as well doing the IEMT. So just tell us a little bit about that. What's this boost that you've experienced?
Well, it's no surprise to people that know me that I've had a few problems over the last few months. I fractured my wrist and haven't been able to work as I was prior. And I was actually struggling with my wrist when I did the training, so I'm proud of myself for doing that. And part of the feedback that this lady gave me was that she was proud of the way that I did the case studies, even with my problem, if you like, that I coped, and she found it really good that I did that. So yes, it's given me a boost in my confidence about the fact that this technique works, because the feedback proves that. But also I got a lot of benefit out of it, as I talked about in terms of taking part in the demonstration. It's definitely changed a few things in me, and as I said, people have noticed. So you know, it's not only you're getting results for your clients, but going through the training, you're getting results for yourself. it's a
Yeah.
no-brainer as far as I'm concerned.
Yeah, it is. You do get an awful lot of, because sometimes I've been to a training and they'll do a demo at the front and that's it.
Yeah.
I was like, well, I want to do it and I want to feel it. So
Yeah.
I make sure this is why I provide the manuals and also some videos and stuff to watch
Yes.
in advance. So that means in the training, I don't just have to read a manual to you, which is what a lot of trainings is. It's just reading a manual. I want to be able to explain the concept, but then do it and show it, and then you do it. So out of the, 14, 16 hours that it is, probably about half of that time is you working on the techniques.
It's practicing, yeah.
Yeah, actual practicing.
Yeah.
And so, yeah, and I'm just going to sit here by myself. What can I do? And then basically, if people need me, they call me into the breakout rooms. But the way that I set this up is that you shouldn't really have to, unless something kind of goes wrong or uncontrollable or something, then, but that's never happened, because the way I set the structure is like, you're going to go work on this little bit. Go and work on this little bit and then we'll talk about it. And I think that's really builds people's confidence, because all you need is one page when you're in the room, because you've got that page and these are the step-by-steps and this is what we need to do. So a couple of things. If people want to sort of contact you, maybe work with you, where's the best place to find you online? What's your handle?
I'm everywhere. I'm everywhere, Matt. It's like,
okay.
So I'm on Facebook. Want to find me on Facebook, and it's a common theme. So I'm on Instagram, I'm on TikTok, I'm on Clubhouse, I'm on Twitter, I'm on LinkedIn. It's all Mind Therapies with Sally. There may be a 1 at the end of it for some of them.
Right, okay.
My website is mindtherapieswithsally.co.uk.
mindtherapieswithsally.co.uk.
Yes.
And the handle Mind Therapies with Sally, sometimes with a 1, people can find you on all the socials.
Yeah.
So last sort of question, now you sort of found me because I did a demonstration in a group and did the technique. Now, there are some people who are just sort of researching IEMT or eye movement therapies in general. They might be already qualified in something, they might not be qualified in something. What do you have to say to those people who are watching this thinking, should I do this training? What do you have to say to these people?
I'd say definitely do it. It's like I said, it's a no-brainer. And I think, again, to go back to the case studies, a lot of training, sometimes if you do a training, you don't always use it straight afterwards. And then you think, oh, well, I'm not sure what I'm doing. But the thing that with having to do the 2 case studies is that you're getting in and using it. And then the fact that you're using it and you get the results then encourages you to carry on using it. Absolutely. So I think that's the bonus on top of cherry on top of the pie, or whatever you want to say, really. But yeah, I don't regret doing it at all. I mean, like I said, it's given me a boost, and I'm ready to progress with that now.
Brilliant.
So yeah, I'm really excited.
Excellent. That's what I like to hear. And what a lot of people say is they may be in a therapist for years, like doing talking therapy or counseling or CBT or transactional analysis, whatever it might be. And then doing this, it makes them excited about working with clients again.
Yeah.
Yeah.
I have mentioned about in a group that I'm in about maybe doing a demo, and I think I had about 30 people interested straight away, just interested in the technique, and not going to give away any secrets.
Yeah.
But just a little demo of what it can do, and the interest was there. So if I can get any referrals for you, Matt, I will.
Oh, excellent. I will. I'm going to be setting up a referral schemes. We'll talk about this later, but I will be setting up referral schemes and stuff for next year. So I'm going to be doing a lot of trainings next year, at least 1 a month, probably 2 a month going forward. Because again, IEMT is like, once you kind of get into it, people are like, this is great. Why don't more people know about this? And we make it, so we're trying to make it more accessible, more well known, to get people like yourselves, hypnotherapists, counselors, NLPers, using this technique in combination with what they're already doing. Excuse me. But people who don't have any experience in therapy or counseling can still come and do the training.
And still, and
still be able to use it. Or if you just want to come on to the training because you want to experience the changes. You don't have to use it afterwards. And I will be offering a reduced rate for that basis. So basically, if you want to just experience the changes and have like loads of different therapists work with you over a weekend, basically, that's fine. Yeah. And then basically, if you want to do the case studies, you want to submit them, you know, you can, but there'll basically be no pressure to do so. So it's going to count.
Yeah.
Cool. Let me ask you one last question is going to be, out of all the experience, what was your single thing that really kind of stood out? You're really going to remember the thing you learned. I know we did the demonstration, obviously, with yourself, but when you sort of think about the whole training in itself, what's the thing that really kind of stands out, that separates it maybe from different trainings that you've done, just something that made it really special for you?
I think the quickness of the technique and seeing the changes happen in front of you, because sometimes with other things, it's a longer process, and things can take time to change and incorporate that change. But certainly on the practices that we did and the demos that we did, change was there. You could see it.
Instant,
it was, yeah.
And what's interesting as well, because you know, I haven't seen you for 3 weeks. That change has not only stayed, I think it's probably grown. You know, and so with a lot of stuff, when I first learned hypnosis, they're like, at the end of a session, the client has to feel good. So make them feel a color, double it, make it 10 out of 10. So they leave that session wanting to take on the world. It's like, well, the thing is, though, they're not going to feel like that tomorrow. So they're going to be deflated, you know. So with IEMT, it's not about making people feel great, it's stopping them feeling bad. And
and it's not I've never been a one for over positivity, like
absolutely
over the top. It's just but yeah, it's you know, I've had that experience using hypnosis on clients that very often the next day they feel worse because because they're processing, and they may have had a headache, and they've experienced the emotions of something that we've been talking about. Not that I know what it is, but they know what it is. And very often they've felt that, and when I check in with them, then they get a progression. But there wasn't anything like that with IEMT. You know, like
it's
you said,
almost like an emotional hangover you can have for some.
But this is I don't know really how to explain it, but I mean, like I said, I do feel different. And
like acting different as well. That's the
and so, you know, why wouldn't you want to to feel that way? Why wouldn't you?
And value for money, how did you find it?
Oh yeah, definitely great. Like I said, from everything that you provide, and before and afterwards, and the support that you give, definitely value from it. I've paid more for a course before. I haven't got half of what you've given. So yes, definitely.
Brilliant. And what I'm going to do actually going forward, I'm creating a membership site. So all the stuff which I send out to you, rather than be emailing it to you, you're going to be a member of a membership site, and everything's going to be there. There's going to be videos, resources, basically what you need to download beforehand and go through. So it's going to almost be like a mini course that you kind of go through before the course in itself. And then if you ever lose a file, and you just click onto there, and it's all there for you to download and everything as well. So that's kind of the next step. I need to go build that actually. Okay, Sally,
go do it.
Thank you so much for your time today. Thank you so much for going through the course and taking things forward. And good luck with now working with your clients. And remember, we're always here in me. I'm always here in the WhatsApp group, and also mainly, obviously, in the Facebook group as well. So enjoy the rest of your day, and thank you.
Okay, no, thank you very much.